Now, the forelimb has been removed by cutting the insertion of trapezius, serratus cervicis, serratus thoracis, rhomboideus, brachiocephalicus, and omotransversus in front of the shoulder joint. This region is the shoulder region, which is formed by the scapula. This aspect is the medial aspect of the shoulder. Just clean the fascia without disturbing the branches of brachial plexus and brachial artery. This flat bundle of nerves on the medial aspect of the shoulder and arm is the brachial plexus. It is formed by the union of ventral primary branches of 6th, 7th and 8th cervical and 1st and 2nd thoracic spinal nerves. Nerves arising from this plexus supplies the entire forelimb muscles and also part of the muscles on the lateral wall of the thorax. This is supraspinatus muscle projecting in front of the scapula, and the remaining part of the muscle is visible on the lateral aspect of shoulder. This large thick nerve is the suprascapular nerve arising from the brachial plexus. It passes in the space between subscapularis and supraspinatus in company with the suprascapular artery. This is the suprascapular artery which accompanies the suprascapular nerve in the space between the supraspinatus and subscapularis and supplies them. This is the subscapularis muscle which has three fleshy parts in ox. These are the nerves supplying the three fleshy parts of subscapularis muscle. This long flat muscle is teres major. It is placed behind the subscapularis. This is the nerve supplying the teres major muscle. This is latissimus dorsi muscle. It is a wide fan-shaped muscle. Only part of this muscle is visible now, and the remaining part of this muscle can be seen on the lateral wall of thorax. This is thoracodorsal nerve arising from the brachial plexus and supplies the latissimus dorsi muscle. This artery is thoracodorsal artery arising from the subscapular artery supplying the latissimus dorsi. This is subscapular artery arising from the brachial artery, passes backwards between the subscapularis and teres major. It supplies the subscapularis, teres major and infraspinatus. This is axillary nerve which is arising from the brachial plexus. It gains the company of posterior circumflex artery and reaches the lateral aspect of the shoulder and supplies the deltoideus and teres minor